Hello, this is Theresa Rohr-Kirchgraber. I'm a professor of clinical medical education at the UGA School of Medicine. And last May, the Medical Association of Atlanta formed a task force with the goal of advancing evidence-based policies that improve social determinants of health and result in improvement of the health outcomes and economic well-being of Atlantans. This is the first in a three-part series that will touch on how physicians and healthcare systems can help influence housing, transportation, and food insecurity in Atlanta. I'm here today with Colin Delargy, the Assistant Director of Strategy at the Office of the Atlanta Mayor, Andre Dickens. We'll speak today about what is being done in Atlanta to tackle housing affordability challenges, touching on initiatives including the Affordable Housing Strike Force, the Atlanta Urban Development Collaborations, the Housing Help Center, Housing Innovation Lab, Faith-Based Development Initiative, and comprehensive land and developmental strategies. Our goal today is to discuss how physicians can help move this work forward, but also to talk about how housing impacts physicians. Colin, thank you for being here today. Can you introduce yourself and share a little bit about your background?
Yeah, absolutely. Thank you, Dr. Rohr, for having me. I'm super excited to have this conversation, especially, in the midst of a lot of exciting activity here in Atlanta about housing. We continue to try to make sure that that housing doesn't exist on an island somewhere, but exists in communities and neighborhoods alongside other amenities that really kind of create this holistic picture. So I love kind of talking about social determinants of health, how housing plugs in, and obviously a variety of state. You're always surprised by who you end up talking to, the Medical Association of Atlanta, but of course, we've all got housing there, so very excited. I'm Colin Delargy. Uh, I'm an assistant director of strategy over at the mayor's housing team in the city of Atlanta. My background is planning and policy, both at Georgia Tech and overseas as well. And for the past 3.5 years or so, I've had the great fortune of being on a very ambitious, very forward-thinking housing team and working with stakeholders across the city, across the region, and across the country to solve both housing issues, but then also, like I said, other issues as well that relate to housing. So thanks for having me.
Thank you, Colin. Well, let's start with housing broadly. When a patient is seen, especially in primary care, the physician has so many aspects of their lives to take into consideration. We want to understand their total situation. When we try to work to care for their health, we also have to work to care for those possible disease conditions. When housing insecurity is a concern, the stress is not only of where to sleep, but also how to store medications, how to be found when there are results to give, and what impact does the lack of secure housing have on one's physical and mental health? Can you talk more about what you're seeing in Atlanta in terms of the connection between housing and health, and why do we call attention to it as a social determinant of health?
Yeah, absolutely. I think that the number one thing that you have to start with is, a home is a place that we each go, at the end of the night. That's where we lay our head down. That's where we rest. That's where we recover. A lot of times when we talk about housing insecurity, the first thing that comes to mind is folks who are unhoused, so don't have that place to go. And that's obviously a major factor in our work. It's a major concern for the kind of policies that we put forth and the funding that we put together. But housing insecurity as well. I mean, I have certainly experienced a variety of different types of housing insecurity, which are, you know, we often say, folks who got more month than money, but, where is that rent payment going to come from? What decisions do I have to make between paying for this thing or paying for that thing? What risks am I exposing myself to? Of will the landlord try to evict me this time, or will they be, kind of more more understanding? These are all types of things that add to a certain stress, and that stress does, we see it all the time, like really start to impact not only individuals but communities writ large as we see that. So and that's just on the financial side. We have a lot of homeowners who may have paid off their mortgage, may even get property tax relief or otherwise, but don't have funds for repairs. So a storm happens, you know, heaven forbid, a tree fall on a roof or something like that, and then all of a sudden we've got this big issue and we have to figure out a way to solve it. Housing and stress are unfortunately very often related. At the same time, housing is the basis of communities, which does the opposite and gives people that social safety network, access to amenities, access to kind of quality of life. So we don't just view it as the problems. Also, like, the flip side is that healthy housing often lays the groundwork for healthy outcomes and like you said, the ability to, I like that you talked about, people being able to store their medication or get information because I think one side of it is, housing is the place that recovery happens after a big surgery, a big kind of medical event to make sure that folks aren't returning back to the hospital, are able to actually move on that trajectory towards recovery and kind of regaining health, and really thinking about stable housing in that context as well. So yeah, so like housing just it affects people for good and for bad where you live. We see in the city of Atlanta, I might be getting ahead of myself, but we see 20-year life expectancy differentials between certain zip codes in the city. 67 in some communities on the kind of northwest part of the northwest corridor, 87 in some of the northern parts of the city. I think that kind of speaks for itself in a lot of ways, the ways in which housing, very literally, and the number one thing that's, kind of the core of all health, which is how long you live.
Mhm.
You're seeing these disparate outcomes. So there's other stuff here too, but I think, really when we think about it here, we think about how do we reduce the stressors that people face to give them a fighting chance, both to kind of take care of themselves the within kind of their medical routines and their healthcare routines, but then also, just within their life as a whole.
Well, I'm so glad that you mentioned the difference in longevity depending on zip code, because where you live does make a difference in terms of how you can get out and how you can exercise and the accessibility and the climate. So many things that kind of go and come into play. But what do you consider to be some of the three biggest housing issues or challenges facing Atlanta?
Totally. Atlanta's a funny place. It's got such an interesting history of housing. For a long time and in a lot of cities, housing Atlanta was known as the place that had solved the housing crisis. For a big city, it was fairly affordable compared to other places. It built a lot. It did these things. That was 15, 20 years ago. Canonically, that's kind of what it was known as. Nowadays, though, obviously my job is to make sure that we build enough affordable housing. So affordability is going to be kind of the number one issue that comes to my mind. That's in the home ownership space. So what does it look like to buy a home, to buy a new home, to buy your first home, and also in the rental space? And I mean, we are seeing numbers that are very unusual for Atlanta over the last 10 years. Rental prices continue to rise. It's tapered off a little bit in the last 9 months or so, but especially during the COVID era and before, as more people are moving to the city, rental prices are rising precipitously. But even things, if you look at kind of mortgage transaction data for the last few for this year and last, we're looking at an average single family home price in the city of over $700,000. Yeah, condos, townhomes are a little bit cheaper than that, but we're seeing that, prices are that's not normal for Atlanta. I think that's not what a lot of people in the city or otherwise um, think about when they think about Atlanta. So affordability is the number one thing that makes it hard for people to find their first home in Atlanta. It makes it hard for people to move into their next home in Atlanta, and oftentimes it makes it hard for people to stay in the home they already have in Atlanta. Um, One thing that we think about a lot though is also like housing stability. And we've had a lot of interesting pilots on that. So stability is the second thing, especially for renters. Georgia doesn't have very strong rental protections. And so a lot of times, especially on the low income of the rental spectrum, it's very easy to end up in kind of informal, precarious, and unstable situations. That might mean, staying on people's couches. That might mean staying in kind of motel-like situation, kind of a more of a motel room than a traditional apartment. But that could also mean, getting eviction notices or writs on your person that come up in background checks later on and make it more difficult to find housing. There's a lot of different ways that housing insecurity and instability, I should say, shows up. And what we've seen is, stable housing obviously is affordable. If you can't afford it, then it's hardly stable for you. But really focusing on housing stability improves outcomes in unexpected ways. There was a really interesting pilot a few years ago, a pilot project that we did where we paired up in an elementary school in the city. We were noticing that there was a lot of transients, so a lot of like midterm exits of students. And we actually paired up with some volunteer lawyers to provide housing related support, guidance, and counsel there. And the transients rates went down because, folks were getting the help they needed to resolve their issue in place and be able to stay in place. And the outcomes for the students was actually better in that case. So this housing stability, we normally don't use that word. We talk about housing affordability, but in our office, at least, we really like to focus on overall stability. And another challenge right now is it surprised me when it came up, but we did a housing needs assessment, seeing kind of where we're looking. We took census data and other data, and housing for families is surprising. We are getting quite a bit of stuff being built, both affordable and not, at least over the last 4 years. Not a lot of 3-bedroom, 4-bedroom places. The stuff that does exist, therefore, becomes more attractive, more expensive, and rises in price. And the single biggest kind of demographic that we saw population exits from the city itself was low-income families. And
Yeah.
so a challenge for us is making sure that the housing that gets built, and especially that gets built using public funds or public support, but across the board, the housing that gets built can keep families in place, can allow for intergenerational living, or is the right type of housing. We need a little bit more diversity in the housing that we're creating. It's been a little monotone for a little while, and it's emerging as a challenge for our school system and for our neighborhoods.
Oh, such important thoughts and considerations that we don't always think about. So you work with Mayor Andrew Dickens. Can you talk more about his priorities in the housing space and some of the initiatives you have in place now to address the main issues that you outlined?
Yeah, totally. I certainly can talk about his priorities. I feel like I talk about them a lot. I mean, the first one is, well, I call them his stump speech three
Mhm.
things. And basically it's, if he's talking, he's probably talking about one of these three things when it comes to housing. So the first one is just getting numbers on the board. We did that housing gaps assessment, and 20,000 was the magic number for right now. That number will continue to grow and change, but the mayor ran on that in his first term, and it's really become a nice rallying cry for everyone. It's 20,000 units of affordable housing is about the gap between what we have and what we need. Um, and with there, like we are talking both about, it's 20,000 units, but we talk about producing or preserving. And so production is just new build. There's a piece of land, there's nothing on it, we build something on it. Preserving is an interesting challenge because of the impacts on communities, families, and health. I think coming back to this thing is how do we take a property that might be in a bad condition or that might be at risk of gentrification, which destabilizes families, and how do we use the tools that we have to step in and actually provide a stable outcome for it? So one example that I really like is on the west side, West End, and we had a property, and it was built using public subsidy years ago through a program called the Low Income Housing Tax Credit. And we saw that it was now approaching its 30-year end of the restrictions that it had to make sure that it was affordable for folks. And usually when that happens, when the subsidy lifeline or timeline ends, what we see is the property runs the risk of being flipped. Families, are asked to leave, the rents get raised, and you have all of this instability there. Especially this was right next to a MARTA station, right in kind of a fun area. And so we saw the risk of that. So we were able to go in, identify, or actually a buyer came to us and said, hey, we would like to just, do some rehabilitation. There's some work that needs to be done here. Do y'all have a program that can work with this where we come in and then we commit to maintaining not only the families that are in place, but also stability for the property for the next 15 to 20 years? And so we found a way to do that. And that's a story that like, it's not as bright and shiny as a ribbon cutting for a brand new building, but the impact for the families that are there is immense. And so we're really trying to focus on having both of those. So I'm just on thing number one. Thing number two is the mayor will often say that his priority is making Atlanta the best place in the country to raise a child. I saw that New York said that too, so we have a little bit of competition, but that's not bad. But you know, that's where kind of that conversation about family-sized housing is interesting, but also it's where a broader conversation um, that I think M.A.A. and others really can grab onto comes in because it's not just do you have an apartment or a home that's big enough for your family? It's also, is it near the amenities that you need? Are there safe routes to school? Do you have the commercial or healthcare kind of, services that you need nearby so that you don't have to drive in a car across town, for 30 minutes, 45 minutes each way in Atlanta traffic? Do you have, quality education, obviously, early childcare, pre-K, all of that? It's part of his like what he's called the neighborhood reinvestment initiative. And I'm blending kind of the second and third thing here, but really focusing on families as kind of a thing to build around within these neighborhoods. It's interesting. We talk to Atlanta public schools and we say, what is, some things that you're hearing about from your families in your neighborhoods? And they'll say, healthcare services is something that's missing in a lot of neighborhoods. And when we ask APS what they would prioritize, things like early childcare, safe and secure housing are there, but healthcare services and kind of access to healthcare is very high up on that list often. That's coming from APS, not necessarily the families directly, but they're kind of mediating that. So thinking about making Atlanta the best place to raise a child, it means partnering across all these things that are normally siloed and saying, you know what, if I'm a family with 2 kids, 3 kids, I care about food, I care about access to healthcare, I care about safe routes to school, I care about housing. So if I'm caring about all these things in a non-siloed way, then we got to figure them out in a non-siloed way too. And then the third is really thinking about the neighborhood as where all of this meets. And that's kind of that non-siloed approach. He'll say, the neighborhood is the unit of change. That's kind of where people's lives are formed. And like I said before, with the life expectancy, we really see it express itself at a kind of a neighborhood level. This neighborhood has this life expectancy, this one has that. We see that, not many schools outperform their neighborhoods in the whole state of Georgia. Like school performance very much aligns with kind of certain indicators on like neighborhood health. And so the mayor's really focused on making sure that when we are doing this work, we're doing it thinking about the neighborhood. Concretely, as a policy, that means if we have a piece of land that's owned by the city somewhere, we see an opportunity, we think, okay, what else is around in the neighborhood? What housing needs are there? What commercial or otherwise needs? And how can we bring those things onto that piece of land? How can we talk with partners and everything to make sure that it gets there so that overall it's additive to kind of this idea of kind of comprehensive neighborhood?
Well, I'm so grateful that you brought up the need for health services in an area. In what ways do you feel like the work that you do is complemented by the healthcare system? I mean, as physicians, how can we help you advance your housing policies for each issue? What ways can we get more involved? And do any of these initiatives seem like a great fit for physicians to be more involved with?
Totally, totally. I love this question. I don't have 100% of the answers. So by the end of this talk, hopefully we'll have more and then ongoing in partnership. But one of the things that pops up right away is is kind of about like what are the location decisions that physicians are making and how can we make sure, for their offices or for their services or otherwise, how can we create programs that encourage physicians to come into neighborhoods either on a permanent brick and mortar basis or finding other ways to link in with existing assets within neighborhoods just to bring healthcare closer to folks. The closer it is, the less folks are relying on kind of the hospital system or the ER system or otherwise to take care of day-to-day needs. And obviously the more preventive care and otherwise that you can do. And what we've noticed is when we've asked this question in other cases, like grocery stores, we've said, hey, we have a food desert, we have a healthcare desert. How do we get grocery stores to come in? And the most helpful part was to sit down and talk with folks who run grocery stores and understand how they're making their decisions and then say, okay, well, what if the city provided this? Would that be something that would be would kind of help steer your decision? So first order, obviously having healthcare services in every neighborhood of the city and the amount that they're needed is vital. But first step is let's just sit down and talk through how are you making your decision? How can we support decisions being made in a way that supports kind of and aligns with some of the neighborhood work that we're talking about? So I think just proximity of services would be like is a vitally important thing, and I would love to continue these conversations there. The next one is kind of the inverse, like if you got an institution, you know, I just heard today about Seattle, I believe, had partnered with healthcare institutions to provide like larger institutional scale financing to support housing development for employees of the institution. So I'm sure we'll talk about kind of healthcare employees also need housing. We would also love it if that housing was affordable and near where they work, especially in the city of Atlanta, because I have a friend who just started a nursing position at Grady, and she is tired and she does not want to go after, a 12-hour shift or more and sit in a car for an hour and a half to get to the next place. So, but a lot of times what Seattle did was, it needs financial support, especially with the federal government pulling back right now. And a lot of the financial support that we become accustomed to, we are increasingly as the city turning both to our own coffers, but then also looking to partners who we can share kind of an agreement or share alignment of mission with and say, hey, hospital system, is it beneficial to y'all, either from your workforce or from your clients, to support financially like the development of housing near the hospital so that we can kind of have these recoveries, have employee retention and other things. So I'm very interested. I know a lot of the physicians probably in your group are not making financial decisions at the hospital level, but just continuing to advocate for that. And then kind of the third thing is knowledge of resources. Like I said about this example of the lawyers that were there to help with housing needs in the elementary school, I know that hospitals and physicians work closely with caseworkers and do a lot of this work. And just maintaining that conversation with the city as we're coming up with a new program, what better place to inform people about it than in an environment where hopefully they're with kind of a trusted physician or they're already working with a caseworker. So I think in some of those cases, we got to find a way to like let y'all know what we're doing, and inverse, um, hear about what y'all are seeing and what needs y'all are seeing. Because we love a challenge here in the mayor's office. We love a problem that's hard to solve. In that getting us in the room together, we tend to come up with something at least. And I think just keeping that exchange open for right now.
Oh, that's awesome. And I'm so grateful that you also brought up the fact that healthcare workers also need places to live, because that's one of the concerns as we look at helping to decrease the physician shortage in the state of Georgia. We are creating new residency programs all over the state. Some of those are in smaller community, more rural areas. And it's great to think that we can have a new residency program in a small rural community, but where do those residents live?
Yeah.
I mean, that's a huge issue. If they can't find housing, then they're not going to be able to get into the residency program. We're not going to be able to create those programs. But with every new physician, there's also the staff that has to take care of, that works with them, the nursing staff, the other healthcare professionals. Being able to create some stable housing, even if it's just during the training processes. You
Yeah.
know, one of the reasons why residents, which are after you graduate from medical school, then you do your additional training, we were called residents because in the old days, we used to live at the hospital.
Right.
So there was obvious housing, but times have changed and very few programs offer subsidies for housing. So that's one of the things that we can really look into is creating and developing subsidized housing for our trainees, whether they be medical students or residents or fellows or early career healthcare professionals. That would be an incredible thing. How do we get our physicians closer to all of our communities? I mean, one way you mentioned was, developing perhaps some more clinical space that is included into the development plans, for housing. What also about, school-based housing? Are there other ways that we can partner with you and the city and create perhaps even with our larger institutional healthcare practices to create some ideas that might be worthwhile?
Yeah, absolutely. I think so, one to circle back to the conversation about employees and residents and nurse and additional staff at the hospitals. We're redeveloping a fire station in Midtown Atlanta. And the goal is to, both create a new fire station, which was built in the 80s, and Midtown looks different now than it did in the 80s. So we need some expanded capacity, but also build a mixed income tower on top of it where, we say anyone from the janitor to the doctor, has a place in there that they can afford, like throughout the tower. But in the process of this, and it's a long process to get this off the ground, and we're working diligently towards it. And in the process of it, we've circulated interviews, circulated surveys to some of the larger hospitals and kind of healthcare providers, and the resounding kind of response rate that we're getting is yes, people are interested. Yes, people want to live nearby. Yes, people would jump at the opportunity. So I think we're hearing it loud and clear, exactly what you said. And things like the projects like that, I think are really exciting. We have the opportunity. We know where the hospitals are, for example. We know where kind of a concentration of health services are. So on the one hand, going there and saying, what opportunities do we have here to build housing, and to build kind of stable, long-term, affordable housing options for folks that are already nearby. And the Midtown Fire Station's an example of that. We just got to connect it at that point.
No,
On the other, go ahead.
no, I'm just saying that's excellent. Because I'm also thinking about, the turnover would be so much less if you're working in a hospital system and your housing is attached or close by or in part of your employment. That would be fabulous. Just think about how you would decrease the turnover of your staff. Oh, keep
Right,
going,
right.
keep going.
And no, I mean that's kind of one of the things that we thought, and also like I mean it very seriously what I said before. It is a hard job. A residency, I've never done one. I don't think I would survive it. So it's to reduce the other stressors around, to make sure that you can just hyper focus on that and do that, I think is also an important part of it. I'll go back to kind of the conversation about just really thinking how do we bring services into communities? And like I said, I love this job because we get to really ask that question. We don't just say, oh, we need services there. Say, all right, we're going to go talk to folks. We're going to go talk to the last 50 people who set up a new brick and mortar kind of healthcare area. And we're going to ask them why they chose where they chose, who they talked to, who they worked with, all of these things. And, I mentioned the grocery stores, and what we heard is, there's a certain amount of risk in running a grocery store, and, it's a low margin business. And there's also some siting issues. A grocery store tends to be big and it's a lot of upfront investment. And so hearing these types of things, we said, okay, well, how can we support by removing some risk, both in the initial investment and then also like in operations? And the outcome after a year or so of working with our development authority, Invest Atlanta, and just stakeholders all around, was we opened Azalea Gardens downtown, or Azalea Market, excuse me, downtown. It's a brand new grocery store that's open with city support in a food desert in downtown, right at Five Point Station, has not had a fresh food grocery store in over a decade. And I'm sure much more than that. I don't have the number right offhand. A parallel I get really excited for in talking about, how do we bring services? If it's an issue of like getting a brick and mortar shop up and running costs too much money. We want to do that in a place where we're expecting certain payments. And how do we talk about lowering that cost? If it's just we just can't find space, how do we make sure there is space? How do we put that space there? If it's that we need a certain density of patients in order to make it work, then these are like actual concrete problems that are concrete considerations that we can work towards. And then to your point, if it's I just don't want to have a brick and mortar store. I want to have it near my house. I live somewhere else or whatever. Then starting to say, okay, well, what are some avenues towards, you know, working with schools, working with existing assets? How much would it take to get, the services into those places? Maybe not on an initially permanent basis, but at the very least to bring that together. I kind of am sounding like a broken record, but it really is like let's roll up our sleeves, really ask the questions why we're seeing these outcomes, and then let's see what we can do to work together to resolve them. Because that's where we get optimistic, is that we really think we can. Yeah, so I like how do you bring it closer? One is we bring it to you, the other is you come to us and we figure out a way to make that work, that everyone's balancing a lot of considerations when they're making decisions. And we got to know what those are to get the decisions to the right place.
Well, it's great that you have the vision and you're finding some solutions. It's not just complaining, where you're actually working on kind of fixing things. How do you suggest that we as physicians, as the Medical Association of Atlanta, how do we build relationships with organizations that share our goal to advance housing policies that improve the health and the economic well-being of Atlantans?
This is a great question, and it gets right to the practical. Like, all right, what do we do? Let's do
Right.
it. So you mentioned in kind of the introduction about some of the work that Atlanta does, that we have a thing called the Affordable Housing Strike Force. And I assume that most people, when they hear that, say, okay, what is the Affordable Housing Strike Force? But what it is, and it's a really brilliant, simple idea. And you'd be astounded how many cities we talk to who, when we tell them, they're like, that's brilliant. We never thought of that. But you identify all of the key public agencies in this case, with some partners, but primarily public agencies that are involved in housing in some way, shape, or form, whether that's Invest Atlanta helping provide housing subsidies, or Atlanta Housing helping provide rental support or developing new land, or Atlanta Urban Development Corporation helping to develop public land to create affordable housing, or APS who owns a lot of land and has families in housing, or MARTA who, wants housing to be close to their rail facilities and bus stops and everything. And we literally just meet once a quarter and we have an outline of key challenges that we need to talk about. And the leaders from all those places are in the room and we get on the same page. And it's been extremely, extremely effective, both in aligning on a single vision, some of the things I talked about before with the mayor's stump speech, but at the same time also being nimble, when changes happen in Washington or at the Gold Dome or wherever, we're able to get together and say, all right, team, how do we do this? So I think taking this model and turning it right back. So starting kind of with committees like this one to say, all right, let's get around the table, let's see what the challenges are. And we're around to have these conversations. I think a strike force like model has proven itself like a good replicable um, forum, where you say, this month, we're going to talk about this one thing and we're going to sit down, we're going to learn from each other, we're going to learn what's already happening. And then we're going to put our thinking caps on and figure out what do we need to do next to make it happen. I think it requires some organizational, structures and everything in place, but I do think it really works. And so I'm on board. Dr. Rohr, if y'all want to, then we'll figure out a way to make that a more regular thing where we address and tackle specific problems and challenges. And then, you know, I know for one, I think, we are doing a lot of homeless work right now in the city. So what does that mean? I think I was on a call earlier today even where all in over the last 4 or 5 years, we've created over 1,000 units, created and funded over 1,000 units of housing for formerly unhoused folks that include supportive services, you know, and that goes through Partners for Home, who's our continuum of care provider here in the Atlanta region. That's projects like the Melody, which was a container ship. We had actually there were some GIFA containers from COVID that were up in North Georgia,
Hmm.
and the hospital reached out. So this is a great. Actually, I didn't even think about this till this
Wow.
moment. The hospital reached out and said, "We built this extra capacity during COVID because we had overflow of patients, and we were just kind of going to go." Do what you do with containers that you don't need anymore, which is try to build corals on them, I guess, in like
Mhm.
in the ocean. But they were like, we were thinking about getting rid of these unless you need them. And we got together and we found a piece of land right next to a MARTA station in downtown Atlanta, a few blocks from Gateway Center and some of the other kind of coordinating centers. It was being used as a city parking lot. And we said, we would like to use this for something else. And we managed to, for pretty low cost, move those containers, which were already outfitted with plumbing, with electricity, with, kind of the general comforts. They weren't like a box, they were done up for the hospital rooms. And we just put them in place. And within 90 days from start to finish, I think it was, we created housing for folks, many of whom were already living within a few block radius of there. They were just doing so without a roof over their head. So talk about a partnership with kind of physicians. But the the reason I'm telling this story, I warned you I could go on and on, but the reason that I'm telling this story is that, we're doing a lot of work on homelessness, providing housing options, trying to make sure that those are aligned with services. We also know that Grady Hospital, other hospitals are oftentimes the kind of first point of contact between some kind of institution and folks experiencing homelessness. So we have a lot to learn from the physicians, the nurses, the just general faculty and staff that are doing that to understand what types of things we're seeing. Are the interventions that we're doing effective? Well, honestly, the hospitals probably know that better than anyone else, just based on what they're seeing. And I think this kind of communication, both a communication about resources that are available, but also like an evaluation, like doctors, nurses, staff, what are you seeing? Like, what are things that we need to be addressing a little bit more? How do we build that into the way that we're designing policies? And those aren't rhetorical questions. I mean, very literally, let's sit down and build them in right now because we need to. So I think that's another very concrete way. We reach out to some hospital staff from time to time, but it's woefully not regular. It's something that I think, especially our team, really strongly advocate for to make sure that the things we're doing are addressing the challenges that are being seen. And in the other direction, we've heard hospital staff say, hey, how should we deal with this? Is there a better way? What are you seeing around the country? What are you talking to your peer cities about? Most hospital staff is in the day-to-day business of running a hospital, so they don't have the luxury I have, which is calling up Chicago and saying, hey, we're dealing with this issue. What are you seeing? And so I think the lessons learned go in both directions there. I don't mean to just talk about hospitals. I know the medical profession is much bigger than that, but
Well, no, but I mean, most of us have either trained or been in or continue to work in hospital settings, and so physicians are involved in things from the very beginning, from when you first come out the door to when you go. So, so when you come in, so I think having the Medical Association of Georgia of Atlanta be able to think about the fact that social determinants of health are a big component of what we do is is really an important ability for us to be able to work together on these things. And I mean, we'd like to thank the audience for turning in, and thank you so much, Colin, for taking the time to speak about this an important topic in Atlanta. Again, this is the first in a three-part series that will touch on how physicians and healthcare systems can help influence housing, transportation, and food insecurity in Atlanta. As a reminder, the Medical Association of Atlanta welcomes all MAA physicians to join us on this Social Determinants of Health Task Force. We currently have about 26 members, but we're interested in having more folks. So if you are interested in working with us to pass social drivers of health bills that improve your patient's health and well-being, we welcome you to join us as a member of the task force. We'll drop some contact information and additional resources in the show notes, but we'll see you next time. And Colin, appreciate the discussion, appreciate the willingness to work with us, and also in your thought process that maybe we have something to offer in this realm. Thank you,
no,
Colin.
totally. Thank you so much for the opportunity. It's been a great working partnership so far, and I'm excited for where it goes.
All right.